There was a time when plastic surgery was said to be for the rich and the Hollywood types, but today it's much more common for us ordinary folk, and we want to talk a little bit about plastic surgery, what questions you need to ask, and what some of the risks are. So Dr. Adibfar is in studio with us today. Thank you so much.
Thank you.
And for those of you that watch the show regularly, you saw me in Dr. Adibfar's office about 2 weeks ago, where I think he did a fabulous job with Restylane and Botox towards my 10 years younger challenge that I have. So thanks for that.
Well, you look great.
Yeah, thank you. I think I look great too.
You do.
So this is what I want to talk about today, and I really appreciate you coming in. I want to let women know what they need to ask in terms of questions. How do you know the background of your surgeon, and how do you know in terms of what possible complications they are? And I think nowadays plastic surgery is looked at a little bit too lightly. We talked about that earlier.
Yes.
It's a medical procedure,
Exactly.
So let's talk about what women need to ask in terms of questions.
First of all, I think the patient needs to, before we start anywhere, they have to realize what they have realistic expectations.
Okay.
And once they approach a surgeon with their expectations, they have to find out whether their surgeon is properly trained to do that procedure that the patient is looking for.
And how do they know that?
And basically the simplest way to find out whether somebody is well trained in plastic surgery is, first of all, look up the registrations in the College of Physicians and Surgeons of Ontario.
Okay.
And then also look up what their training is under the Royal College of Physicians and Surgeons of Ontario of Canada.
Okay. Okay.
And essentially that way you will find out whether a physician is a family doctor or a neurosurgeon or a plastic surgeon or a cardiac surgeon for that matter.
Okay, now for a plastic surgeon, what does that mean in terms of training? Like, are you in school for how many years and what are you training?
In general, plastic surgery training is about 5 to 7 years after medical school graduation, and all of that, if not most of it, is in surgical training, general surgery, as well as plastic and reconstructive surgery training. And a component of that is in cosmetic surgery. So I just wanted to remind you that plastic surgery in general, plastic surgeons in general, they do much more than just cosmetic surgery.
Right.
They actually do hand surgery. They're trained in reconstructive surgery for cancer. There's trained in craniofacial surgery, in burn surgery, and so forth, as well as cosmetic surgery.
Okay, so the cosmetic part is one aspect to
Yes.
a large breadth of knowledge.
They need to find out whether, first of all, the surgeon is comfortable with that procedure or not, and whether the surgeon has done adequate numbers of those procedures.
Yeah, that's a good question, isn't
That's
it?
correct. And then they need to find out whether the procedure is being done in a facility that's been accredited by the Canadian Association of Accreditation for Outpatient Surgery. And following that, they need to find out who is administrating the anesthesia.
Okay.
Is it the anesthesiologist or is it the nurse? If so, are the nurses well trained in advanced cardiac life support or not?
That's a good idea. Okay. What other things should women be looking for when they're, well, men as well, but what other things should they be looking for when they're looking at a surgeon, one compared to the other, or how are they supposed to know? How can you tell? Like it's a hard thing, I would imagine.
That's a great question, and you brought this up. I strongly recommend that you see more than one surgeon for the same procedure, perhaps 2 or 3 of them. So rely on your gut feeling and basically interview all those surgeons, just like they're going to be interviewing you, and feel comfortable. Remember, it's a two-way street. Both your personalities have to fit for a good outcome.
All right. So what about expectations? You mentioned that earlier.
Expectations are important. First of all, you have to feel comfortable and basically see whether this procedure is going to take care of your issues and your concerns. You have to remember that cosmetic surgery is just an external procedure.
Right.
And if you have internal concerns or stresses, that may not necessarily take care of those issues.
I'm so glad you said that, because that's one of the things we talk about on the show, is that you have to work on the inside and the outside together. That's why I like you.
Exactly.
Okay, so, and what about the whole issue of, I don't know, it seems like nowadays that cosmetic surgery seems like it's bubble gum, like everybody's doing it. It's like go to get your hair cut, and that's just not true.
And
is it?
just you brought up the word haircut. I need to stress the fact that plastic surgery or cosmetic surgery is not a haircut. In fact, your body cannot differentiate cosmetic surgery from any other procedure, whether it be it heart surgery or cancer surgery. They're all traumas to your body, and your body cannot differentiate from that. And therefore, you should not take cosmetic surgery lightly.
And you mentioned to me earlier about maybe even interviewing somebody that had done the procedure. Like, let's say you refer new patients to previous patients so that they can talk about that same procedure. I think that's a great idea.
That's correct. I think it's important. I commonly offer to my patients calling other patients that have previously gone on that procedure. And that's the best way of finding out about the potential complications afterwards, what to expect and not to expect. And you feel a lot more comfortable. Remember, a doctor can tell you a lot of things, but they may not necessarily feel your concern and your pain.
Right. Thank you. That's wonderful. So just to recap, we need to look up the surgeon and do some research, right? Come armed with a set of questions to ask, right? And also make sure our expectations are realistic. Okay, so that is great information. So Dr. Adibfar has been kind enough to give us a couple of website links, and we will put them up on our website so you can check that out. And thank you so much for coming to talk to us today.
Thank you.
All right.